Hi, my name's Mehnoor. I'm one of the core surgical trainees kind of giving advice today about the portfolio aspect of applications. So welcome to our presentation. Obviously, a lot of you probably have an interest in surgery, so good on you for attending. Hoping this is aimed towards kind of medical students, F1s, F2s, F3s, people who aren't in training, you know, just because it's useful. And it's also kind of transferable across specialties, even if you're not really decided. So yeah, so hopefully we'll be able to give you some good advice and some kind of real world tips and tricks to get your portfolio up to scratch and your CV. So yeah, we're gonna it's focused on preparing your portfolio according to the 2021 self-assessment guidance. So hopefully it's useful for medical students. It's useful to kind of start thinking about these things because it's something that's going to come up in the next few years, and the years go by quite quickly once you start training. And if you're in foundation training, it's also useful to kind of think about what kind of things you need to start doing on the wards, and getting together supervisors and evidence as well. If you've only just realised that you've got an interest in surgery and you're an F3, I wouldn't be disheartened. Plenty of people realise that they like surgery quite late on, so there's always room for you guys, and hopefully we can give you some advice regarding your portfolio. So for this presentation, we've got three core surgical trainees. We'll be discussing components of our portfolios and ways to improve your CV. Just a few words on our society to start with. So we're the Yorkshire sect of the Foundation Trainee Surgical Society. Relatively new. We've been ongoing for the past couple of months. We did a presentation last month kind of aimed at F1s for their first surgical jobs. And we are associated with the Royal College of Surgeons of Edinburgh. So our core committee is a group of foundation trainees, and myself, I'm a core surgical trainee. And we've got a team of registrars and advisors from the Royal Society that guide us. Our main aims, we want to improve kind of access to high quality surgical education, affordable and relevant surgical courses, audit and research networks, and provide support for your portfolio and career development, and promote and encourage foundation trainees and medical students to pursue a career in surgery. So we're going to be providing a series of events throughout the coming year, so keep your eyes peeled, join us on our social media, and add your email address to our mailing list. Okay, so main aims from this event. We'd like to introduce you to the core surgical training self-assessment scoring section of the core surgical training applications. We want to provide kind of proper, real-world, easy to follow guidance about maximising your scores, especially from sections that may be deemed to be difficult, and that's going to be from us guys, the trainees who have successfully secured core surgical training positions. We also want to show you that you don't have to get the full amount of points to be successful in attaining a surgical training position. I mean, I don't think any of us scored maximum points in our portfolio, so there's always something to be gained from that. And then we just also want to solidify, surgical training is open to everyone really. Just to kind of mention, core surgical training applications, they can seem a bit daunting, and when you look at the portfolio, it might seem quite overwhelming. I know I felt quite overwhelmed when I first had a look at it, but you can definitely break it down into discrete segments to tackle throughout your training, throughout your medical school. And not all the sections require years of work and effort. Some of them can be done quite relatively quickly, but it's always good to have an idea of it, especially if you're in your medical school training at the moment. And so what we've done for this presentation, we've kind of split the portfolio into three separate segments. Number one is commitment to specialty and degrees. Number two is teaching experience and audit. And the final section is kind of publications, prizes, and leadership. So we're each going to take on a section, and then at the end we'll have a chance for questions and answers if you can type them in the chat box. You can also type throughout the presentation as well, and hopefully some of the registrars are available to answer any of these questions while I'm presenting. Okay. So just a quick word. So current process for submitting your portfolio, it's online. It's the same for 2022 as it was for 2021, completely online. So your portfolio, if you exceed the cutoff for your self-assessment score, it's submitted electronically via an online portal prior to any interview. So it means that there is a cutoff score for your self-assessment. So it's determined by your self-assessment score. If you don't meet the cutoff, which is going to be set this year, it won't be the same as last year. It depends on how many people apply and what their kind of average scores are. If you don't meet the cutoff, then you won't progress to the next stage of actually submitting the portfolio. However, I would advise against exaggerating or lying because that's a probity issue and it may land you in front of the GMC. So if you meet the self-assessment cutoff score, then you will be allowed to submit your evidence onto the online portal. So you can submit PDF, Word documents, images. Sometimes you may have to convert some of your evidence to PDF, and there are tools to do this online. Just make sure that you check and double check any evidence that you submit, make sure that it's correct. Because I think people can get caught out. They might submit something and actually it's a different file that they meant to submit. Also kind of advise you to kind of submit and structure your evidence in the format of the self-assessment guide. So it means starting with your commitment to specialty section and ending with your leadership section. It might be useful if you're submitting a number of pieces of evidence for each domain. It might be useful to include a cover sheet with headings and subheadings of all the evidence that you're submitting. This was also very useful when you had to do a paper portfolio because it gave examiners easy access to, you know, what you're actually evidencing, and then you just show them the evidence when you go through your portfolio. But it's also easy for the examiner to kind of scan through your portfolio and they know exactly what you're submitting for each section. So essentially, the examiners are not going to have much time to review your portfolio. About 1,200 people progressed to the stage of submitting portfolios out of 3,000 applicants last year, I think. So they only have about 10 minutes to kind of look at the evidence and then move on. So if you've not made it easy for them to kind of award you the points, then they're not going to award you the points. I think there's some people might make an argument to submit only your highest scoring piece of evidence for each domain to make it easier for the examiners to award you points. However, if you don't meet the point score that they think that you actually are, then you will lose points. So what I did is, if I was a bit iffy about a section, I submitted a number of pieces of evidence just to make sure that I didn't drop down to 0 points. Okay, and just make sure that you start gathering your evidence quite early on. Make a folder on your computer with headings of the domains, and then enter your evidence into each of those domains. It's also useful to kind of keep an up-to-date CV so that you know exactly what you've done, because actually, if you've done a presentation back in a medical school and you're an F3 now, you may have forgotten about it. You might have forgotten about some prizes that you achieved. You know, there's a lot to be said for kind of human factors of, you know, human just being able to just forgetting what you've actually done. So just make sure that you're aware of everything that you've done during your training. And then just make sure that everything's clearly labelled. If it's not labelled correctly, then they might not see it and they will not award you the points. And then it'll have to be a long drawn out process when you appeal. you can't submit further evidence once the portfolio locks down. So make sure that all your evidence is on there that you want to be seen. And yeah, just make it easy for them to award you the points in essence. So we've got Radha, who will be tackling this first section. So I'll allow her to speak, and I'll just move the slides along for her. So she just tells me when she wants me to move on.
Hi everyone, thank you so much for the introduction. I can't actually see the slides anymore, but don't worry, I have it sort of open on my laptop, so I'll give you a shout whenever you want to move on. So yes, my name's Radha. I'm actually post-core surgical training, so I've done my 2 years. I did them in Yorkshire Deanery, so I did 6 months of urology in Huddersfield, 6 months pediatrics at LGI, and then 12 months in Hull. And my theme was pediatric surgery. So at the moment, I'm kind of doing, if you like, the equivalent of an F3, so a CT3, just locuming and then applying for ped surgery this year. So I did F1, F2, then I went into F3, where I did, well, that was essentially when I decided I wanted to do surgical training. So as it was mentioned earlier, don't feel if you have not had this passion for surgery ever since starting med school that now it's impossible to do it. I'm a prime example of you can do it at any point. You just need to make your portfolio work for you, and you should be fine. So yeah, so I did my F3. I applied during F3 for surgical training, and I got interview and my place, well, my first choice place in Yorkshire Deanery the first time round. So my total score was about 70%, of which I had 41 out of 72 for my portfolio. So again, not the highest of marks, but I tried to maximize as much as I could. And as has already been mentioned, be generous to yourself when you're doing self-assessment. Don't lie, but if you're querying whether or not, say, a diploma or PG cert or anything like that would count as a degree, put it in. The worst that can happen is they take it away from you, but at least it's flagged up for them to query it, which is what happened for me. Fab. Should we move on to MRCS Part A slide? So I did my exam in CT1, but if we just kind of backtrack and say, so the membership of Royal College has Part A and Part B examinations. So there's 3 sittings for Part A each year, so about January, April and September. And it's a written exam mainly focusing on basic sciences. Now with COVID, that was turned to a virtual exam, which is what I sat. So whether or not that's planning on changing is still up in the air a little bit, but either way, it's a written examination. And then Part B is more like an OSCE style. And then once you've got both, you have your MRCS qualification. So if you've passed Part A, then you can get 3 points at this point. You get 1 point for failing the exam, or even just booking onto the exam, but not sitting it. So even if you just book onto the exam, that would get you a point. So if you can try and sit the exam, even if you don't feel prepared, I know it's about £550 per sitting, you are going to get at least a point towards your applications. So yeah, so I did mine in CT1. So given that I had only applied in F3, I wasn't geared to be doing core surgical training. I took 2 attempts to do it. Most people, first few attempts, couple of attempts, and you should have it. My main advice for the exam is just do loads and loads of questions. But the main part of your learning will be when you review those questions. So give yourself enough time and be very organized, because trying to work and do your exams at the same time is difficult. So if you're ahead of the game, straight out of med school tends to be an easier time because you've got everything fresh in your mind. But then again, for me, I found it that having done some work already and had a surgical job, that also helped me. So there's a sort of a bonus either way, but do lots of questions, be organized with it, and try and start early where you can. Brilliant. Should we move on to surgical courses, please? So if you've done 2 courses out of the list of courses that are provided, then you can score a maximum number of 2 points. But again, these courses book up very quickly, so try and get in on this early. Check the Royal College websites regularly, and book as soon as you can. Again, be flexible with where you do these courses, just so that you optimize your chances of getting onto a course. I would suggest that if you find that on the Royal College everything's booked, sometimes it's worth contacting them directly. So on the Royal College, you'll have a email address or a phone number for certain people who are in charge of the courses. So try and contact them and see if you can at least get onto the waiting list, because if somebody drops out, for instance, last minute and you're on the waiting list, they can contact you to book you on. Also look at the ACIT and BMA websites, because you can get some surgical themed courses there. So you can do surgical student skills as well. Some of the ACIT ones will still count for you. And for me, I hadn't attended, again, any courses beforehand, but I had done some other surgical skills courses which had gained me some points. So I forgot to mention at the beginning, because I applied around 2018, the scoring system was slightly different. So we would score differently for this, but I've tried to base what I had and what I would get as per this 2021 guideline. So yeah, try and get the courses. I would aim to try and get at least BSS, and if you can get ATLS, that would be good too. But BSS is really helpful for once you start your core surgical training or even a surgical job. And then also helpful is the ATLS for your interview. Brilliant. Okay. Oh, just a point there. Study leave. You can get study leave for these courses, but you would need to book in advance. So make sure you're in good communication with your rota coordinators. You don't want to book onto a course and then find that you're on call for those days, and then you can't get those days off, for instance. So just try and be organized with that. So next slide is surgical experience. Now, in this, for us, it was not quite so strict as to 15 cases. There was no numerical value. It was more your level of involvement. So you've been assisting, or you've very proficient with certain skills, or you've got a wide range of skills that you've been proficient in. Whereas now they've put it down to just cases. So again, depending where you are in your training at the moment, if you're a medical student, it might be more difficult to get those numbers. F1, F2, if you've got a surgical job, fantastic. If not, then we'll talk about the taster days shortly, where you can try and get these cases done. So guidance advises you get involved with a variety of cases and of varying complexity. So not just sort of abscesses and things. Try and get in on slightly more complex surgeries if you can. Try and do some orthopedics, ENT. Again, med school is a great time for this, because you'll have allocations to this. So it's just keeping a note of everything. As we mentioned earlier, you want to try and document as much as you can. Keep a spreadsheet and just write in there, were you observing, were you assisting? Did you even do any part of the, even some suturing or anything? Just have a note of it somewhere. And then you can collate that when it's ready for you to get your portfolio together. Yeah, so again, those assisting, observing things is all in reflection with the e-logbook, which is what you'll carry on throughout your core surgical training. And this also shows your awareness and your commitment to surgery. So little things like this will go in your favor if you have it nice and organized in a manner that they're expecting or they're used to seeing. but just bear in mind, a consultant needs to sign off your logbook summary sheet. So the best way of doing that is right at the beginning of any surgical placement, express your interest in surgery and what you want to achieve. So as I've said, this is slightly changed from when I was there. So make your seniors aware they've probably had to do different things for their portfolio. So just let them know, look, I need to get 15 cases for me to get my maximum points on my portfolio. Can you help me get that? So speak to one of the registrars, even the SHOs, any core surgical trainings might be working with, and they can help you, and they can then advise which consultant will be happy to sign you off and things like that. If you're even as a medical student, I suppose, but more F1, F2, it might be worth, if you don't have a surgical job or you don't have one before your application, that you consider doing some weekend elective lists, and that can kind of tie in with the surgical tasters. So sometimes I'll have small procedures, it won't be as pressurized as during the day, and you'll be able to just have one-to-one with a consultant or a reg to try and get some cases, just to observe or even assist with them. Brilliant. Okay, so let's move on to talk about surgical tasters. So you can, if you've had 4 to 5 taster days in surgery, that will give you your maximum points. But just bear in mind, you need to provide a reflection following this, and that would be your proof of having conducted it. It's essential that you book these taster days early on, because you don't want to have too many clashes, obviously, with rotas and things like that. So this is more applies for your F1, F2 jobs. So right at the beginning, when you start your F1, your first job, check with your foundation administrators, and they'll advise on how you take the leave for these taster days. Sometimes you get all 5 days in 1 week. Sometimes it's just a day every so often that you can then add together. If you've had a particular surgical job, for instance, if you've had orthopedics, don't take your taster day in orthopedics, no matter if that's the only thing you ever want to do. Try and just show an interest in other areas. For instance, in core surgical training, you will still have to cross cover as an orthopod, so you might be doing ENT or urology, so it might be wise to try and get some experience in a different area of surgery, and also shows that you've considered other specialties within surgery. An alternative is, like I said, doing weekend elective lists. That kind of could be considered as a taster if you can't get your time within the rota. I did some sort of summer tasters. I had the opportunity to go abroad during my second year at med school, and then also when I was in F1, F2, I used to use annual leave to do voluntary projects and do work abroad, and that's where I gained a lot of experience. I appreciate that's costly, and not everybody wants to use annual leave to do more work. So those are ways of, again, these are some things that I did prior to choosing surgery, but then I made them work for my surgical portfolio. So try and pick things out like that. And then a supervisor for those taster days. Again, the foundation administrators might be able to help because they would have arranged these taster days quite frequently. Alternatively, speak to your regs or SHOs within the surgical department and see if they can advise who would be the best sort of head of department or best surgeon to the surgical consultant to supervise your taster days. Brilliant. Okay, so surgical electives. If you're undertaking surgical elective, you need to have a reflection following that, and that will give you your maximum 3 points. So if you're in med school still, now is the prime time to start planning, to try and look at the range of placements that you can get, whether it's local or whether it's going abroad, but have some specifics as to what you're going to gain from that elective and what they're going to provide you in terms of training or experience in surgery. You don't want to turn up there and find that you're not actually doing anything surgical, or you're just on a surgical ward. Ideally, you want to be in theatre during these times. And And those reflections should be detailing on what you've learned, what you've seen, and maybe even comparing to your, if you're going abroad, how it's different to your home country and things like that. There is an elective prize that ACIT provides, so it's worth putting in for that. That's just an additional thing and an additional sort of push towards your making sure you get your points, your evidence and things. Medical students, if you are not sure about whether surgery is 100% for you and you have another specialty that you're considering, use your elective at the time to try and get that taste or experience. So you don't have to say that I did 5 weeks of surgery. It's just a case of saying I did my elective in surgery. So whether you've done 2 weeks or 5 weeks, as long as you put that reflection in. So use 2 weeks for surgery and 2 weeks for another specialty if you have an interest in that. And then again, as I've mentioned, for F1s, F2s, if you haven't managed to do an elective in surgery, maybe try and do some sort of placement during annual leave, whether it's local in a specialist hospital or whether it's abroad. So just for me personally, I did my elective in Kenya and I did it with a company. And I, at that time, was unsure as to what I wanted to do, or I had an interest in several things. So I did some peds, some obs and gynae, and some surgery. But again, if I was to apply for pediatrics, I could still use that to my advantage, and I've managed to use it for my surgical advantage as well. All right, final bit now. Degrees. Relative to all the other sections, this section has the lowest amount of points. So don't get bogged down or disheartened if you've not done an intercalation, you've not got a PhD and things like that. If you're F1, F2, it's a bit late for that now. Don't start stressing about having to do all those things at this point. For me, I had done a PG cert in leadership, in medical leadership, and I'd done a diploma in tropical medicine during my F3. So although they don't specifically come into this part of degrees, I put that down in my self-assessment, and then it was flagged up during the portfolio station and queried, and I think I got 1 point for it. But again, if I hadn't mentioned it because I was unsure, it just wouldn't have gotten noticed, and I might have not gotten that 1 point. So put it down. The worst thing that happens, it's not considered lying at this point, you're just unsure. So the worst thing that happens, they say, actually, no, that doesn't count towards anything, so we can't give you the points. Now, I don't know, as I said, I can't see the slides, but this last slide was just a summary of my portfolio station. You'll see that the scoring is different because we got points awarded for audits and QI projects and things as well. So ignore those parts, but you can get an idea vaguely of what my points were. So that's my bit. I hope that helps, and I know there's a bit of time for questions later on, but if not, I'm more than happy to be contacted, so you can get my details from the team. All right, best of luck, guys. Thank you.
So our next section is by CT1, who's an ENT run-through trainee called Joe, and he will be talking about teaching and audit. So I will just lead it to him.
So I've been asked to talk about teaching and audit. So before I crack on with that, we were asked to kind of introduce ourselves to you guys. So my name's Joe. I'm currently a CT1 in Bradford. As Mehnoor said, I'm on the ENT run-through program. That was what my portfolio score was, and my interests include ENT, obviously, but also I'm quite interested in medical education, which we'll talk a bit about in the next couple of slides. So do you want to go to the next slide, Mehnoor? Thanks. So effectively, the first bit I'll talk about QIP and audit. So this is a huge section. It's worth lots and lots of points, and loads of points are up for grabs. So it's definitely worth considering and kind of planning for doing QIP and audit. So it can be quite daunting because it's worth so many points. And I don't know what your experience of doing audit and QIP in particular is, but starting a QIP project from scratch, you know, that's designing one, coming up with an idea, implementing it in the real world, and then analysing it, is quite a feat, especially in kind of the NHS, and when you're working full time. So you do have to be organised. But what I do want to say is that it is actually quite achievable if you follow a few tips. So to maximise your chances of success and point scoring with QIPs, you need to be strategic. So there are a couple of things you can think about rather than coming up with a completely novel idea yourself. You could potentially continue a project someone else has already started. So when you come to a new department, you could ask around about what that department does, how involved they are in quality improvement and audit. And you'll find that most departments have someone that's interested in quality improvement and are usually pretty keen for people to help them out. So that's definitely one way of kind of taking the pressure off yourselves with coming up with a novel idea. If you are going to come up with a novel idea, my suggestion is to pick a really small change. So it's quite easy to get a bit carried away, and particularly when you're doing a quality improvement project, you have these big grand ideas about how you're going to improve the NHS and make it better for everyone and solve all the world's problems. And it's really easy to get carried away. But the problem is with doing that is A, it won't happen, and B, you'll just get really disenfranchised by it. So pick a small change, preferably one that is meaningful. And the key and top tip that I would say is that if you're going to come up with a change idea, then you definitely need to make sure that it's easily measurable. So the change that you're doing is very easy to measure and the data is easy to collect. So there's no point doing a change that actually the data only comes out every 6 months. That is just it's useless. It's not going to be helpful for you at all. So you want to pick something that happens every day, something that you can monitor, introduce a quick change, and then re-audit it quite quickly. So pick small, make sure it's easily measurable, the change that you're going to come up with. If you're coming up with a novel idea, that would be my tip. But do consider continuing the project on. You'll still get points for it. The other thing that is a good way to do a QIP is to pick a evidence-based thing. So whether that's kind of a clerking pro forma, or whether that's an evidence-based protocol, or something like that, pick that, because that's really useful, especially when it comes to kind of writing this up or presenting it. It's really useful to have an evidence-based tool, clinical tool that you can use. And also, if there's an evidence base behind it, then people will be quite keen in the department to adopt it. They're more likely to adopt it and get kind of get behind you with it. So and I'll talk more about this in a minute, because this is what I did. So if you can come up with kind of an evidence-based clinical tool, then that's quite good, and it's pretty handy and it's quick to implement, because you don't have to come up with the idea yourself. It's already made for you. You just have to introduce it to your department and work out how you're going to measure whether that tool changes things for the better or not. Okay, so it saves you a bit of work. My other suggestion is most definitely team up with someone else. So doing a QIP is quite a lot of work, particularly when you're working full time. So I would say definitely team up with a friend, preferably someone that works or is doing the same job as you, that works in the same department, and do it together, because it'll halve the workload and improve the amount of data you can collect. The other tip is definitely get an enthusiastic reg or consultant on board. So this is so key, because the problem with quality improvement projects are that often people are very good at coming up with change ideas and coming up with methodologies about how to implement that change and collect the data. But the problem comes when you actually implement that change on the wards, because people are busy and it's not their top priority. And that can actually be quite discouraging. So you have to be pretty motivated, which also helps to have someone else doing it with you, because when you're having a bit of a crap day, they can kind of pick you up a bit, and vice versa. But if you have an enthusiastic reg or consultant on board, then it's great, because people in the department are more likely to listen to you and get behind your idea. The other thing to say is, if you have a consultant on board or a reg, then you can get them to write you a letter for evidence for your portfolio. So that's something that I definitely suggest. So if you do a QIP and say you present it at the local hospital, or even better, at a national conference, make sure you get your consultant to write you a letter outlining your role within that quality improvement project and what you did. And that will be evidence for your portfolio. The other thing to say is, once you've done the data analysis, you've done all the hard work, make sure you write it up. That doesn't have to be a formal publication. I mean, it can be if you want, and there's a journal, the BMJ have a whole journal for quality improvement called BMJ Quality, which has a really clear method, really clear structure to follow. So if you want to write it up, that's great, but that is quite time consuming. But what I would say is, at least present it locally. So here you can see I've just put the top score, which is 11 points that you can get for this. So it's a huge points. So you get 11 points if you do a QIP and you present it at a national conference. So obviously that can be trickier to get it accepted in a national conference, although it is easier than you think. There are lots of conferences out there. So just because you do, I don't know, say you do a quality improvement in general surgery, you don't have to look for just surgical conferences. So widen your scope. So, you know, the Royal College of Surgeons do various conferences. The Royal College of Surgeons of Edinburgh, remember, and Ireland are alternatives. The Royal College of Physicians, the Royal Society of Medicine, the Royal College of Physicians of Edinburgh. There's so many that do general kind of royal colleges that are outside your specialty. So it doesn't have to be specialty specific when you're supplying your presentation. So when you're submitting it to conferences, it doesn't have to be specialty specific, and that's quite an important thing to remember. But you can also get 9 points, which is a huge amount of points, even if you just present it at your hospital. So this is the other reason why I say try and get a reg or a consultant involved, because if there's a reg or a consultant involved, then you'll 100% get to present it locally in your department, because they'll want you to present it at their department. So if you do the project, that's 9 points in the bag, which is huge amounts of points. So that is they're my top tips for QIP and making it easier for yourself. So teaching again is a huge section, big point scorer. There's kind of two bits of teaching. So there is your practical teaching, so which is here on the left, and you can score a maximum of 8 for that. And then there's also formal teaching qualifications, which is this on the right, so you can score a maximum of 4. So overall for teaching you can get 12 points, which is again a huge amount of points. So there are a few tips again for teaching. So to score big, essentially you need to design and organize a teaching program. Organize is a very key word there. It doesn't mean you have to teach every session yourself. It just means you have to come up with the program and organize people to teach it for you. So you could actually get away with not teaching any of them as long as you organize the teaching program. But I guess you'd probably want to teach if you'd gone to the trouble of organizing it. It has to be a program of sessions, and it has to be at least 3 months. So a teaching program basically just means multiple sessions, and it is time dependent. So they want you to do it for at least 3 months to get the full points. Now that doesn't have to be kind of, 12 weeks of weekly teaching. If you could do that, that'd be great, but it would be quite hard to do. You could do 1 monthly teaching session for 6 months. You could do 6 fortnightly sessions over 12 weeks. But the point is that you're doing it for a protracted amount of time, and doing it for more than 3 months is the key thing there. The other thing you need to do to get full marks is get formal feedback. So you can teach loads, and you often do teach. You'll find as a junior doctor, you'll teach medical students all the time, kind of on an ad hoc basis. But to get the points, you need to prove that you've taught them and got feedback. And the way they do that is by asking for formal feedback. So you can do that quite easily. Most people just have a generic piece of paper with kind of a feedback form, and have some in your bag. And when you do a teaching session, give the students it. That's one way of doing it. Or if you're a bit more tech savvy, you can set up kind of a Survey Monkey questionnaire and send the link out to your students for them to fill in. But the key thing is getting formal feedback. So if you set up a session that has multiple teaching sessions in it, lasts longer than 3 months, and you get formal feedback, then you're going to get at least 6 points. So the way you either get 8 points or 6 points is all down to basically how widespread your project is, or your teaching program is. So if you do it locally, you get 6 points. So that's, for example, in your hospital. If you do it regionally, so say kind of across the hospitals in South Yorkshire, for example, you would get 8 points. So that's the key difference, but 6 points is still a lot of points. So the key thing is making sure that you have multiple sessions that's more than 3 months and that you get formal feedback. A top tip for trying to spread the geographical area is using online learning. So you can use online learning to make sure that it goes out to other people in either other deaneries or other areas within the deanery. So for example, if you did a teaching session at University of Sheffield or Northern General in Sheffield, you could also do it at the LGI or have it at University of Leeds as well. So if you do, and that's much easier if you do an online learning session. So online learning is a good way forward if you want to try and maximize the regional spread. Also use your friends. So obviously after medical school, you all go off to different deaneries and places, team up with a mate and come up with a teaching program between you and do it at each other's hospitals in different areas, and that means that it's kind of more than just a local teaching program. So that would be something else that I would suggest.
Moving on to the last kind of section of the portfolio before we do our question and answer session, mainly based on leadership, research and prizes. And I think a lot of people can find these sections quite daunting and getting a bit worried about them, because they offer a lot of points, and I think people often struggle to think laterally about how they can gain points in these sections. So hopefully I can kind of assuage some of your fears. Obviously some ways to gain points in the section require a lot of effort, but some are relatively simple and don't take that much time. So there are lots of options, and hopefully my own personal lived experiences can help as well. So just moving on. So yeah, so just to introduce myself again. So I'm a CT1 in Yorkshire and the Humber. My current job is in Hull, but I have jobs in Leeds and Bradford as well. I'm on a trauma and orthopaedic theme, which I've been interested in since first year of medical school. So it's been a long time coming, really. And I'm aiming for a career in academia, which I thought would help with the section on research and presentations. I came straight from F2 to core training. I've not really had any breaks at all. So medical school to foundation training to core training. And I scored 50 out of 72 points for portfolio, and actually scored probably the most points in these few sections. Okay, and so just we'll just move on. Okay, so publications. I think a lot of people can get quite stressed and worried about publications. It's not as difficult as it may seem to attain a publication. The scoring system mentions first authorship, co-authorship, and then talks about kind of letters, case reviews, case reports, editorials, reviews, and also mentions writing a chapter of a book, but I think a lot of people probably won't have done that. To kind of get into research, you know, it can be quite daunting, quite difficult, but really what is really useful is getting a good supervisor. So if you're in medical school and your academic supervisor is interested in research, then I would definitely have a word with them. If you are on a placement at medical school, definitely speak to your kind of supervisor, know who is the professor or the academic leads in the department, and get involved that way. Also, some departments will have academic clinical fellows and PhDs, so definitely just have a look and express an interest. Obviously, you know, during medical school, you may have been exposed to some research student selected components. I would recommend just kind of maximizing the use of your time on these SSCs, making sure that you kind of get something out of it. So if you're doing something, it's always good to try and get something out of it. For example, at medical school, at my medical school, we had a specific research SSC. So it's always useful to kind of write something up at the end of it and show it to your supervisor and see if you can see if it's possible to publish it if they are happy as well. Obviously, I think a lot of people can get a bit stressed about this section if you've not been exposed to research during medical school or done an AFP. It doesn't mean, you know, that you can't get any points, like I said. Case reports, I mean, some people think that they might be related to being kind of weird and wonderful, but, you know, sometimes case reports can be about a condition that something new has been discovered, or it can be regarding like kind of human factors, so difficult matter of communication, diagnostic doubt, ethics. So when you're on any rotation, just keep an eye out for cases. Some consultants will actually have a number of cases that they want to write up for report. So if you kind of get in their good books, then you can and make a good impression, you can ask if you can write up their case report for them so that you can be added as a co-author or first name author onto that case report. So in terms of letters, you can also publish letters to the editor about articles that you have read and of which you have any kind of information or argument or, you know, kind of criticism of. So definitely keep an eye out for that. Other ways in which you can get involved in research, obviously, if you've done a previous degree, if you've done an intercalated degree, obviously during medical school. And then with regards to publications, you can also publish by presenting at a conference. So some conferences will publish their abstracts from that have been presented. So just keep an eye out for those kinds of conferences that do that as well. Some papers are, such as the British General Surgery, are involved with conferences. And then kind of making the most of your opportunities. So your elective, if you do surgical elective, try and get involved with a research department wherever you are. I would recommend just doing some data collection, data analysis at where you've undertaken your elective, just to make the most of it. You know, you get points for doing a surgical elective, but you also can you can also gain other opportunities while you're learning about the surgical aspects of wherever you've gone for your elective. And then also something that's really, really useful to know about is collaborative research. So there are a number of organisations. One that springs to mind is Star Search, because I was involved with them, where you can do collaborative data collection and collaborative research projects, and people who are involved are then listed as collaborative co-authors. And that does count as being a co-author of a PubMed cited original research publication. So maximum points here are 7 for first name authorship of 2 or more PubMed cited original research publications. Then it's 6 points for being a co-author. So you don't necessarily need to have been the most involved in a research project to attain co-authorship. You just need to satisfy the criteria for co-authorship. But if you're involved in data collection analysis, if you have a hand in kind of writing up the manuscript, then that does count. That does satisfy the criteria for co-authorship. Obviously, writing some parts of a book, I think not very many people will have done that. So I'm not really going to touch upon that. And then, like I said, case reviews and letters and editorials can score you the least amount of points. So I think it's a bit easier for me to kind of touch upon my own experiences. Because obviously I have an interest in academia. I've always tried to seek out research opportunities. So during my elective, which I did at the North Sydney Orthopaedic and Sports Medicine Centre, I spoke to the research department there, expressed an interest in collecting data for any research projects they had ongoing, and I was able to perform data collection for this project. So that's not actually, I'm just remembering, that's not actually the one that's been published. But I also was involved in a different surgical elective that I arranged, kind of self-organised during medical school during my holidays, in a TNO centre down in Birmingham. So this is where I became involved in a research paper looking at surgical education in low to middle income countries. So because I've done an intercalated degree that had a heavy research component, I had experience in writing up manuscripts and data collection from doing audits previously. So I was happy to write up the manuscript and submit it for publication. So there I'm a co-author because I'm the second name author, and I'm the corresponding author for that publication. All in all, that took about a year to actually submit for publication. So it's something to have in the back of your mind quite early on, because publication, actually writing it up can take a few months, and collecting the data can take a few months, but actually submitting for publication and getting it accepted to a journal that is PubMed citable and has a high impact factor is quite, time consuming. So it can take a number of weeks to months for papers to be in review, under peer review, before you actually even hear back whether it's been accepted with revisions, or rejected. So there's definitely something to have in mind before you in quite early on. Another thing that I wanted to mention was about Star Surge. So I did mention this previously. When I was a third year medical student, I was involved in the outcomes after kidney injury and surgery audit. It was a national audit. I did some data collection for a couple of weeks, and now I am named as a co-author on 4 collaborative research publications. So it's definitely a good idea to have a look at all these collaborative research audit networks, because it can pay off well in the long run. So definitely something to have an eye on. And one of my conference abstracts was published when I presented my BSc research at the Society for Academic and Research Surgery. Currently, I think I have 4 research publications in the pipeline, 1 from my degree, 2 from my F2 job, and another one from my elective, which I mentioned previously. Obviously, it's important to have good supervisors. I'm still in contact with my BSc research supervisor and currently reanalyzing the data set from that research project to submit it for publication. I mean, having done a BSc, it's given me opportunities for obviously my research project, but also to present at national conferences. You don't necessarily have to have done a integrated degree to get involved in research. I mean, when you're in medical school, or if you're on your foundation placement, just like I said, contact someone who is known for research in the department and is known to be a good supervisor, easily contactable, and will allow you to get involved in any kind of research project that they have ongoing. Another thing to consider about actually writing up a manuscript is there are a number of workshops available that are either free or have a fee payable, that concentrate on writing up manuscripts for publication. I've not actually attended any because of my background from my integrated BSc, but generally these are really good ways of fleshing out an idea that you've had, or if you've already got data for something, the how to actually write up this publication so that it reads well. Other things that you can kind of publish are audits. So I think Joe mentioned that there is a BMJ a journal that allows you to publish quality improvement projects. Other things that you can kind of think about publishing are, obviously we mentioned cases that you've been involved in with consent from the patient themselves, but also anything that you've done in a student selected component. So if you've done something kind of weird and wonderful, like I think during medical school I did an SSC in social enterprise, I was advised by my academic supervisor to write that up for publication in the BMJ. I didn't at the time, which I regret now, but it's definitely something to keep in mind. So if you've done something during medical school that is a bit different, and you think that you can write it up, then I definitely recommend writing it up. It doesn't matter if it doesn't get published. It's also a good exercise in writing, writing up manuscripts. Okay, so I'll just move on. Presentations, again, mildly highly scoring, you can get a maximum of 6 points here. You only have to have done 1 oral presentation at a national or international meeting to score the maximum points, and then it kind of cascades down based on how the region covered, so if it was national, international, regional, local, and then whether it's an oral presentation or a poster. Generally, oral presentations are seen as more challenging, so are awarded more points. And I think when you think about specialty applications, posters sometimes aren't even counted. So it's always good to kind of submit to a conference for an oral presentation. because it gives you an exercise in answering difficult questions about your research or whatever you've decided to present, and it gives you an exercise in kind of speaking about your research or your area of interest or whatever you've submitted to this conference. So yeah, but I would, doing a poster is also good. You can get 5 points for submitting a poster, showing a poster at a national or international conference after you've been invited to do so. So main ways of kind of getting presentations are through audits, by performing research, and by being involved in cases, and during medical school. So yeah, again, like with research, it's really important to have a good supervisor, because often conferences will ask you to submit an abstract. So everyone who has been involved in your project needs to kind of have a look at the abstract to make sure that they're happy with what you're submitting. And a good supervisor will actually point you towards conferences that are relevant and will be a good exercise in presenting. Local meetings can involve your hospital M&M meeting, junior doctors forum, junior doctor teaching, and you can present audits, you can present kind of advocacy work, just making sure that you have it's that you've been invited to do this, not that you've made you've kind of done it without being asked, if you see what I mean. Okay, so from my own experience, I've actually presented at 3 oral presentations at national conferences, and that was off the back of my BSc research. So I presented at the Society of Academic Research Surgery, one at the Royal College of Surgeons of Edinburgh, and one at the British Conference of Undergraduate Research. So I didn't necessarily present all of them at surgical conferences. I also looked at other conferences that were available. So the British Conference of Undergraduate Research was actually open to any kind of research that was performed. So even humanities work, it was actually really interesting to kind of get involved in that as well. So doesn't necessarily have to be medical or surgical. It can be anything as long as it's a national conference. And then I've also done a local presentation for a trust-wide audit. So another thing to kind of consider is that when you submit an abstract to a conference for a presentation, you may be automatically entered into a prize. So certain conferences will ask you which session you will want to present in. Some of them will be prize sessions. Some conferences will just, if you have been selected for an oral presentation or a poster presentation, you may just automatically be entered into a prize for that section of the conference. So it's really important to kind of have a look at that and see where exactly, what exactly you think your, whatever you've done, your research, your audit, your case, your medical school, volunteering work, anything, whether you can get a prize from that. Because if you present at a national conference and you gain a prize from that, you then have a national prize, which is the next section that we're talking about. So I'd also recommend, if you do any audits, definitely, like Joe said, write it up and make an abstract and submit it to a conference. There are a number of conferences, obviously the Royal College of GPs, the Royal College of Surgeons, physicians, anything that's relevant, and you think that you can kind of gain something from attending this conference, then I would definitely recommend submitting your audit. Okay. Prizes, again, this is something that people can kind of get a bit worried about, because you can score up to 8 points in this section, and often people don't actually know how to obtain a national prize. So there are a number of ways of obtaining a national prize, actually, and not all of them are difficult. like I mentioned before, you can gain a national prize from attending from submitting an abstract to a conference and being entered into a prize session for that conference. You can also kind of research and submit essay prizes. I know a lot of specialty societies put on essay prizes as part of their society. So you can if you're good at writing, you enjoy writing, then you can definitely submit an essay. And not many people actually submit these essays, and you can gain a national prize out of it as well. Then moving down, obviously if you've done well enough in medical school and you've achieved honours overall, then you may be awarded 6 points, but it also depends how many people have been awarded honours. So here it specifies no more than the top 15% of the year. So you need to have evidence that the people that have been awarded honours that the year group is not more than 15% that have been awarded honours. So you need to discuss with your medical school, make sure that you have a letter from them that kind of evidences that. Then moving kind of further down, it talks about specific parts of the foundation programme or the medical school course where you've achieved a prize or a distinction. And again, it specifies a number of people, so no more than the top 20%. Again, you need to have evidence that supports this. Also awarding 4 points as a regional prize related to medicine, and then moving further down, it's some kind of local prizes related to medicine and scholarships and bursaries. So the kind of difference between regional and local is that local is just one trust or hospital or medical school, whereas regional is a wider area encompassing other trusts, hospitals and medical schools. So it's really important to have evidence that shows that whether it's regional or local, because I think there can be a bit of a discrepancy, and if you don't have the correct evidence, then you might not get the points that you actually should be awarded. So personally, I researched and submitted an essay to the BOTA Junior Essay Prize, and I was the runner-up. I got a certificate for it and some money. So I submitted my certificate to the evidence portal and received the maximum amount of points there. Again, like I said, not many people actually submit essays because they think it can be time consuming. This actually only took me a few days, and it was something that I was interested in and enjoyed doing. Again, you can probably get something out of it as well. So some of these prizes actually, one of the prizes could be that it gets submitted in a journal if this specialty society is associated with a journal. So it's something to look into. You can get a number of points across the board by doing kind of one thing. So it's definitely something to look into. There are a number of essay prizes available online. Just have a look at the Royal College of Physicians website. What I did was I Googled prizes available, and I found the essay prize that I'd be interested in submitting an essay for. So definitely have a look at that. Again, I also got 2 scholarships to attend conferences, which is something that I also submitted just in case my prize wasn't deemed to be a national prize. And I also submitted my elective bursary. Like I said, you can apply for elective bursaries from the Royal Colleges and from societies of different specialties. If you've done that and you've won, then that's counted as a national prize because it's open to the whole country. And again, like I said, when you present at certain conferences, you may be automatically entered into a prize. And again, if it's national, then it's a national prize. So there's lots of points to be scored across the board. And like I said, you can get a number of points from just having done one thing. So definitely something to look into. And then finally, another section that a lot of people don't really like, leadership and management. It can be one of the most daunting sections because it's high scoring and actually requires a bit of forethought and a period of time and effort to be spent. because you have to spend at least 6 or more months in the role. So there's a number of ways to get involved in leadership positions, I'd say during medical school and your foundation training and post-foundation training. Part of the move towards surgery not being a solitary act anymore requires people to demonstrate the ability to lead and manage a team. So you need to be able to demonstrate that you have the abilities of a leader, and it's something that's also assessed at interview. Again, the way that the points are stratified here is by region covered. National positions score the most. You can get 8 points for holding a national leadership role, and it can be related to medicine or not related to medicine. And then it moves down to regional and then to local leadership positions. So again, on the left-hand side, I've listed a number of ways in which you can get involved. So there are medical school societies that may operate on a local, regional, and national level. If you get involved on a local level, then you can kind of progress up to a national level if they have that provision. There's also, if you're a foundation trainee, there's also the provision to get involved in the Junior Doctors Forum or the MES. Obviously, this would be a local leadership position, but if you were involved in the deanery, that would be a regional leadership position. And there are opportunities for F1s and F2s to get involved that way. Again, like I said, national societies and specialty specific societies also have representatives such as ASIT, and I'm sure there are other societies that have a junior representative and a medical student representative for these societies as well. Definitely, if you have an interest, I'd recommend getting involved, having a look, seeing what's around. If you're interested, then it's something that will actually be good for you if you're passionate about it. So obviously, if you're not passionate about something, then I wouldn't recommend doing it because it can be time consuming and it does take a lot of effort. Another thing that you can get involved in is the BMA, and again, this can be a national leadership position. So definitely, if you're interested in advocacy, it's something to take a look into. Personally, I was involved in on a national committee of a charity. Some of you may have heard of it. It's Sexpression UK. So I was involved on the national committee of that charity for 2 years. I submitted, my evidence that I submitted was that everything that I was involved in the charity, everything that I instigated, and everything that I kind of spearheaded as well. So it's really useful because I was involved for 2 years and it actually gave me a lot of transferable skills. Like I said, I'd recommend finding something that you're interested in and passionate about. So obviously what I've done is something that I was interested in. It's got nothing to do with surgery, but it has given me skills that I have spoken about in interview. So definitely something to think about while you're in medical school, while you're in the foundation training. I didn't actually include my other leadership roles because I knew that this fulfilled the brief because it was a national committee. Again, other things that you can do to get involved in kind of local level is if you're a foundation trainee, you can get involved as being a rota coordinator. You can get involved with a Royal College. If you're a teaching fellow, that's a leadership role. If you're a research fellow, that's a leadership role. Have a look at any specialty societies that you might be interested in joining, and just have a look when their AGMs are, because that's when they will decide on new committees. And also the fact that it doesn't have to necessarily be related to medicine. You can also be having a leadership role on a sports team, on a charity. And mine wasn't really related to medicine, so it was a non-medical national leadership role. Okay, so sorry for that. It's ended up being a longer presentation than anticipated, but I hope you guys kind of gained something from it. And I hope it was useful for when you're kind of preparing your portfolio for applications. If you're an F2, F3 now and you're applying for the 2022 intake, then good luck. And I hope this has actually been useful. I know that the application deadline is usually the start of December. So if you start kind of getting your portfolio together now, then you'll definitely have it ready in time for when you actually need to submit it.